Okay, well, that sounds great. Well, we have some questions from our chat room. Hang on one second.
Actually, a lot of questions. I'll start with this one. What are the payment models? Does the physician have to pay to have a relationship with No More Clipboard?
Sure. If the patient has a No More Clipboard account and they say, I want to send my PHR to this physician, and they direct us to do that, there is no cost to the practice. Now, if the practice says, oh, I really like this, I'd like you to put it on my forms, or I'd like to build a portal, then we've made that really affordable for the practice. It costs about $1,900 one time for the whole practice to set up that portal with the branding and with all that secure messaging functionality. And then we charge $35 per physician per month. And with that, you're sponsoring the PHR for all your patients, and then unlimited use of all that secure messaging, online appointment requests, refill requests, and those sorts of things. So it's a really, really affordable model for the practice.
So what happens if the patient incorrectly enters some information? Are you able to annotate or correct things patients have filled out incorrectly?
Sure, a couple of things about that. First of all, the way we've set up the personal health record is that the patient doesn't need a medical degree to complete it. In fact, we've got a lot of intelligent autocomplete functionality built in so that, for example, as a patient starts to type in the name of a medication, they'll be presented with a drop-down list of the medication. They can click on that, and then they'll be presented with the most common form and strength. As they start to type in things like allergies or procedures, the same sort of thing happens. If I start to type in cancer, and I type in CA for cancer, then all of a sudden just typing in CNA and the cancer term is gonna pop up. So we've tried to minimize the opportunity for error. With that said, though, there is the opportunity to go in and annotate that and correct it. You can do that within the application. But we also we do remind clinicians that you are getting patient-supplied data, and you do have to. That doesn't eliminate the need to take your own history, to ask questions, to probe. It's just because now it's electronic, that doesn't mean that the patient is going to be completely forthcoming or that they're going to remember everything. But our view is that you have a much better likelihood of getting more accurate, complete information if they're completing this at home versus trying to remember these things in the waiting room.
Okay, one more question.
Sure. So I know that, like, physician reimbursement is in part based on how complete their review of systems are. Can physicians be reimbursed for patient supply information? I mean, even if they cut and paste or claim that they took the history themselves, how does that work?
This is one of the great things about when we set up the portal. When we automate that for the practice, a couple of additional things happen. We not only have the information we normally capture in No More Clipboard, but then we'll automate any unique questions to the practice as well as a review of systems. So the patient, before they send the PHR to the practice, they'll be asked all the review of systems questions that practice normally asks. And then when it gets transmitted, the practice has a dated, time-stamped review of systems supplied by the patient, so that if they ever do get a compliance audit, you've got that proof that, yeah, we actually collected this information from the patient. The other thing, too, just from a reimbursement point of view, is that right now proposed meaningful use guidelines include patient and family engagement requirements. And for practices that put in one of these portals, they're going to be able to check off that box that, yes, we can share data electronically and do it according to the ARA guidelines.
Okay, we have another question from the chat room.
Do you license at the practice level? Are there tiers as far as for physician practices as far as purchasing that product?
Sure. There are a couple of different tiers. Some practices will say, you know what, I'm not quite ready for that branded portal experience, or maybe I don't even have a website at my practice yet. Is there another alternative? And one of the things that we can do is we can, for about $500 for the practice, is we can go ahead and take their forms, scan them in, and define them, map the fields in No More Clipboard to the fields on that practice form, so that any time a patient says, I want to send to that doctor, that it automatically gets delivered on that practice's forms. And then that practice can send all of their patients to No More Clipboard and just tell them, find my practice in the database, click send, and it's going to arrive to me. So again, there are some low-cost ways to get started.
And one more question from the chat room.
So I was reading something about, and obviously this week is a lot of talk about mobility. Can you talk a little bit about integration with your product?
Sure. When we created No More Clipboard, we said, it's clear that more and more applications are moving to mobile devices, whether it's an iPhone or some other web-enabled device. So one of the things is that you can log into No More Clipboard from your phone. You can pull up your personal health record, view a summary of your health. You can also direct us to send the PHR to your doctor right from the cell phone. You can enter the doctor's fax number and we'll deliver it on your behalf right then and there. And then also you can upload values. So for example, if you're diabetic and you're keeping track of your blood glucose, you can enter those blood glucose values right into your phone and they'll automatically upload to your personal health record. The other thing is we're just getting ready to launch a project in Washington, D.C., with George Washington University Hospital and Howard University Hospital, where diabetics in underserved areas will be given a personal health record. And when the PHR is created, someone will actually help them create the PHR, collect some diabetic HEDIS measure information, and a clinician will set ranges and goals for things like A1C and blood glucose. And then the patient, the primary way they will interact with the PHR is through their phone. And so they'll, for example, they might get a daily reminder to input your blood glucose measure. They'll punch it into the phone, and then based on the goals that have been set by a clinician, let's say they put in a blood glucose measure that's way too high, they'll immediately get an alert saying that you're out of range. You need to contact the Howard University Diabetes Treatment Center immediately. And again, we recognize that for many patients, they don't have regular internet access, but so many of these patients do have a cell phone that they use day in and day out.
All right. Well, thanks so much, Jeff. This has been fascinating. I really appreciate your time. And let everyone know where they can find you here at HIMSS. For those who are following us from HIMSS, what's your booth number? Where is it located?
Sure. We are in booth number 457, and it's down at the end of Hall C, right by the Interoperability Showcase.
By those core people.
Exactly.
Got it. And for those who are remote, where can they find you online?
Just go to our name, www.nomoreclipboard.com.
Very good. Okay. Well, thanks for your time. This is Dr. Val Jones, founder of GetBetterHealth.com. Better Health is the company. Get Better Health is the URL. Thanks for joining us.